Hi, this is Keith Arcari, physical therapist with Symmetry Physical Therapy. Today I'm going to talk to you about shoulder impingement syndrome. Right here we have Symmetry Sam. Say hi, Sam. I'm going to use this model to demonstrate what shoulder impingement is. What is shoulder impingement? Well, what happens is the muscles inside the shoulder joint here get pinched in between this bone here and this bone here. Hence the name impingement. Okay? The scapula and the humerus are the two bones that make up the joint, and if there's not enough space in the joint, you will cause impingement syndrome. What causes shoulder impingement? Well, there's many causes of shoulder impingement. The first would be repetitive overhead activity, such as overhead athletes, baseball, swimming, or individuals that do work such as sheet rocking, painting overhead, electrical work overhead. All those things could lead to impingement. Another cause is falling onto an outstretched hand, okay, because what that does is it jams your shoulder into the scapula and pinches the muscles, okay? Around this joint, there's a capsule, a joint capsule that holds the bones together. If that joint capsule is tight, you could also have impingement. Another reason is poor rotator cuff strength. If the four muscles that encapsulate the shoulder are weak, you would get impingement because the mechanics are faulty in the joint and it'll pinch the muscles in between the bones. Other causes would be bony causes. Some people have different types of acromions. That's this bone here, the tip of the scapula. There's three types of acromions. Type 1 is a flat acromion, okay? Type 2 has a little bit dip of the bone into the joint. And a type 3 would be a acromion that's extremely tipped into the joint, okay? And if that tip is in the joint, it can cause impingement. In addition, if you have arthritis in the glenohumeral joint, you could also have impingement, such as bone spurs on the end of the acromion or bone spurs on the end of the clavicle. Those are what cause impingement. One of the telltale signs of impingement syndrome is called a painful arc. A painful arc is when you reach overhead, you get to a certain point, which is here, and you experience pain. The reason for that is because this is when the bones come into the closest proximity of each other as you reach overhead. We call this a painful arc. So you reach up to here, you start to experience pain. Once you get past about 120 degrees, the pain does tend to go away. Okay? And as you release the arm, you'll have pain going down. But the painful arc is the telltale sign. Another sign would be sleeping on the shoulder at night would be painful. And the third is that usually the shoulder is more painful in the morning. There are a number of clinical tests and findings that lead to the diagnosis of shoulder impingement syndrome. First, your physician may order x-rays to see what the bones look like in the shoulder to determine if you have arthritis or if you have one of the type acromions that could lead to impingement, type 2 or type 3. Or if there's any bone spurs under the acromion or clavicle that would lead to impingement. Secondly, range of motion testing can be performed and find if you have that painful arc. Okay. The third thing we like to test is strength testing to find out the strength of the rotator cuff. Again, if your rotator cuff is weak, the biomechanics of the shoulder will be off, and again, this will cause shoulder impingement. We test the joint mobility of the shoulder. The glenohumeral joint has the capsule around the joint, and in the impingement syndrome, you may have a tight posterior capsule in the back here, or an inferior joint capsule that is tight. And lastly, we do some special testing. One of the telltale signs of impingement syndrome is called the Hawkins-Kennedy test. When the tester raises the arm up 90 degrees and it internally rotates the arm, creating impingement in the shoulder, and this should be painful. Treatment of shoulder impingement first consists of reducing the pain and inflammation in the shoulder. Once the pain is reduced and the person is able to move better, we would then move on to strengthening the shoulder and improving range of motion. Based on your diagnosis, if the inferior or posterior capsule of the glenohumeral joint is tight, the physical therapist will emphasize on stretching your glenohumeral joint to give more space into the joint so you would be able to move your arm up and not experience impingement. The muscles that are strengthened are the rotator cuff muscles, the four muscles around the glenohumeral joint, as well as muscles around the scapula and shoulder blade. At times, these muscles are weak and can also lead to the scapula not getting out of the way when you abduct your arm overhead. So basically the goal is strengthen the rotator cuff muscles and strengthen the periscapular musculature. In addition, we also look at the neck. If there's tightness in any of the neck joints, that could also lead to impingement. So we include a thorough evaluation of the neck to determine if there is any stiffness or tightness in the cervical spine. If you think you may have shoulder impingement syndrome, stop down to Symmetry Physical Therapy or give us a call. We can make a proper diagnosis and get you on the road to recovery.